The historical perspective. We have done all kinds of infrastructure things. We did some with disease. What do we now need to do? Give me a historical perspective.
So serious medicine is the conscious, direct attempt to intervene in the course of life-threatening and life-ruining diseases with an idea toward curing them. After all, just common sense says if you prevent a problem from happening, you're better off than paying for it to happen. And look, I'm all for healthy eating and prevention and no smoking and all those things, but people still get sick of horrible diseases, and it's still a huge loss to the economy as well as to society. So let's fix that. And so the challenge is to create a framework around how this can happen. Right now, if you look down on the Earth from Mars and said, gee whiz, you know, Americans and their leaders talk vaguely about health and good stuff, but then all you see on TV are ads for trial lawyers suing the pharmaceutical companies and, you know, reports about the backlog at the FDA and so on. So clearly these Earthlings, at least the Americans, aren't very serious at all about medicine. Now, how we got to this point is an interesting chain of historical circumstances. But here we are. Here we are with the number of new drugs down 60%, the number of new antibiotics down 80%, medical devices down 40%, capital in the field has collapsed. So we have a severe problem in our hands. So rather than just give up, we need to obviously look ahead. But let's also think about how we address these sorts of problems in the past, including in areas other than health insurance. For example, back in the late 18th century, Alexander Hamilton, our first Treasury Secretary, said that America faced a crisis of industry and technology. Having been through the American Revolution, he was very conscious that we nearly lost the American Revolutionary War against the British because we didn't really have a way to make muskets and ships and so on, you know, the military-industrial complex of the 18th century. And so he said he issued something called the Report on Manufactures, which he delivered to President Washington in 1791, and it was embraced by the first United States Congress, saying we need a system of internal improvements and, you know, industrial action and so on to get an American industrial base going here inside the United States. And then over the years since then, we said, well, we need canals and we need railroads and so on. All these things were done with a conscious effort by the government, in both parties across the country, to say, listen, the railroads are really important, not just for commerce and so on, but also for national security. And so we're going to, even in the Civil War, President Lincoln was trying to, started building a railroad that connected, you know, Council Bluffs, Iowa to Sacramento, California. It was completed in 1867. But it was so important that even during the Civil War, when it's far from clear that the Union was going to succeed, he still figured, look, at least the North will have this transcontinental railroad. So, you know, and in the 20th century, the government made a decision, look, we want to favor a telephone network. It is so important that we have a telephone network where every telephone can talk to every other telephone. This was the AT&T, the Bell system, which was created after 1913. They created a system around that, and then we created a system around radio licenses and television licenses, and then, of course, the internet. So in history, we said, look, we want this to happen. We're going to arrange subsidies and tax credits and preferences and anything else we can think of. It's a messy, sometimes sloppy process, and some critics will say it's, you know, corrupt and rotten. But we got a lot of canals. We got when the Erie Canal was finished in 1825. Connecting up the Hudson River to the Lake Erie and the Great Lakes, that within 3 years of it being built, the commerce on the Erie Canal was triple that of the Mississippi River, triple. It made New York the Empire State. This is an enormous success. So we need to look at those successes in the past, canals, railroads, telephone, television, internet, and say, how can we create a similar system now for medicine, so that that Martian up in space looking down at us, watching us now kill off our own pharmaceutical industry, will say, gee whiz, those Americans are really serious. They really want to see each other, themselves, get healthier and have longer lives. And there's only one way to do that, which is to take medicine, the stuff of life itself, very seriously.
What is the Hamiltonian framework for serious medicine?
The Hamiltonian serious medicine would be an enterprise zone, which, as far as I'm concerned, should be the entire United States. If you make medicines in good faith and the FDA approves them, for the life of me, I can't see why a trial lawyer should be able to sue you. I just don't get the idea how, if the government thinks it's safe and effective, if they do, then the company makes it, and then somebody says five years later, keels over and gets sick of something, that if John Edwards or his equivalent can convince some jury somewhere that the pharmaceutical company is guilty of, you know, $30 million or whatever, that's a crazy system to do it. If people get injured from medicine, they should be compensated. There should be more of a workman's compensation model rather than an entrepreneurial, buccaneering tycoon a pirate model. It would be a conscious policy, public-private, hopefully Democrats and Republicans working together to say, look, we want to make this, that is the United States of America, the most attractive place to study and research and manufacture pharmaceuticals and other life-saving technologies and materials. And if you do that, folks, not only will you be a hero, not only will you put your face on Mount Rushmore next to the other guys, but we'll also make you rich. That's the American way. And that we need to go to that point because we're spending the money anyway now on feudal care. We need to push the money towards actually curing people. That's the serious medicine argument.